Good morning, 9:30 callers. I am your pinch hitting co-host, Titus Dostromedius from Strategies for Children. We've got a few more folks joining from the waiting room now, but let's turn it over to our guests today. Robyn is here, and could you please, well, thank you for joining us, and then please say a little bit about yourself and how you came to your current role.
Great. My name is Robyn Riseberg, and I'm the founder of Boston Community Pediatrics, which is the first nonprofit pediatric private practice in Massachusetts and one of the first in the country. I'm a pediatrician and I have practiced in community health for about 15 years and was the head of pediatrics at the South End Community Health Center and helped to start a school-based health center at the Blackstone School in the South End and became just a bit frustrated by the bureaucracy of medicine, which I'm sure none of you know anything about, and decided that there must be a better way to deliver high quality care to kids with low income that really centers all of health, like mental health, physical health, and the social determinants that affect health. And so, about 5 years ago, we're actually about to have our fifth anniversary in November, created Boston Community Pediatrics.
That's great. And we have some folks in the chat who remember you from last time you were on the 9:30 call, so that's great. Yeah,
Great.
so you have some slides?
Yeah. So,
Excellent.
I'll just kind of run through what we're up to these days and a little bit more about the work that we do. Um, So this is a picture of our office. One of the other things when you get to sort of reimagine healthcare, or as I always like to say, create my utopia of healthcare, you get to reimagine what the healthcare facility looks like as well. And so I was really excited to create a space by patients for patients that really welcomed everyone into the space. And so this is our front desk. And then if we go to the next slide, you can see uh, as we go through, I'll be able to show you some of the other unique aspects. One of which is that all of the art in our office is has been created by Artists for Humanity, which is teens who are doing art for our patients, by our patients, because we have a lot of patients who also participate in the programs there. So when we think about like why start a new model of care, obviously healthcare has been around a long time, and we are in Massachusetts, where it's some of the kind of greatest institutions in the world, frankly, for healthcare. But if we think about where we are. Kind of not meeting patients' needs. It's if you start at the patient and think about their experience, that's really different than starting at like the large institution and thinking about how we want to approach healthcare from that aspect. And so when I created Boston Community Pediatrics, we really started to think about what's the experience of the patient and how can we make that better. One of the things that I found is that many people in healthcare are kind of set on doing healthcare the way that they've always done healthcare, whereas other industries like biotech, like the venture capital industry, were really interested in kind of, oh, let's look at a new model, and they always have different kind of models going on to try and find which is the best one and which is going to work best. Um, as I created this, I looked at like what is working around the country, what are new and exciting innovations, not only in Massachusetts but elsewhere. So direct primary care, concierge medicine, which has really kind of taken off in the adult world, but less so in the pediatric world, and just other interesting and innovative models of care. And then I had to say, well, what works actually in Massachusetts? And small private practices are where many people get their care, along with health centers and large hospital systems. And I thought, well, the small private practices in general work because people actually, when you call, you can get someone usually on a phone. They usually have a like set number of patients for a few providers, and people actually know the office staff. They know the providers well. And I wanted to really create that. But knowing that there were so many wraparound services that were needed if I was going to focus on providing care for kids with low income, which was my focus. And I had the benefit of having listened to families for 15 years while I was at the South End Health Center and hearing from them, like what worked and what didn't work, what they wanted to see. And so I was able to bring all of that knowledge and experience and their experience into the model. So as I mentioned before, we have integrated mental health services, integrated care navigation and wellness services. And I'm going to go into more detail around what actually integration means. And I think the thing to really remember is we put patients at the forefront of the model. And so I think when I talked about healthcare before, it often starts like at the administration and then kind of filters down, and the patients are at the bottom. In our model, the patients are at the center and the first thing that we think about, and everything that we do flows out from the patients. And we're really trying to kind of shift what typical kind of like power dynamics have been within healthcare and think about what does it mean to actually trust your provider and have trusted conversations between patients and providers, whether that's a mental health provider, whether that's a medical assistant, whether that is someone from our care navigation and wellness team, like a family partner. So we had to think about a framework of how we want to think about how we're doing and what we're doing and how we're doing it. So the quintuple aim of healthcare is something that people talk about, which has 5 major components: improving patient experience, improving population health, reducing costs, improving. People often talk about the provider experience, and I like to extend that to the staff because this is not about just the medical providers. This is about our entire team, and everyone on our team plays a vital role in the work that we do. And we treat everyone on our teams sort of with equity and equally and with the same benefits. And then the last thing is advancing health equity. So as I mentioned before, our office feels differently. When you walk in, it's bright, it's cheery. And then we really thought about like, how do we center the staff and make sure that we're meeting not only the patient needs, but the staff needs. And so we really have an emphasis on staff appreciation. This is a picture of like our Valentine's Day celebration. And we really include the staff. We have in all that we're doing and creating, we have a weekly staff meeting where all staff participate. And through this, we are really able to focus on providing the very best care for patients because we're providing the very best environment for ourselves. Just to give you like a snapshot of like how we're operating. So last year, these are 2024 stats because we're in the midst of 2025, but we have 22 staff members. We now have 23, about 1,600 patients at the end of 2024. We're now close to 1,700, about 7,400 annual visits, which includes 1,675 mental health visits and does not include, these are in addition to about almost 2,000 care navigation and wellness encounters. And those are when our patients are meeting with our care navigation and wellness team outside of when they're meeting with the providers or the mental health clinicians. And also those visits also happen in conjunction with medical visits and mental health visits, but then also in addition outside of those visits. As you can see, 80% of our patients have Medicaid as a primary or secondary insurance. And the majority of our patients are Black and Latinx. And then about 17% of our patients are white, and then a small slither identify as other. I'm going to go quickly through sort of how our traditional model kind of disadvantages families who have low income. So these are just the basic facts. Children from low income backgrounds are 3 times more likely to have an unmet health need. The reimbursement from Mass Health is significantly less than that of private insurance. And the other thing that I think people often don't realize who aren't in healthcare is that there's no standard for reimbursement rates. So every practice, every health system has different payer negotiations. And so it's not like when you're planning for a healthcare practice, I can't say like, oh, if I do this, I will be reimbursed $100, $200, $300. It's like the Wild West. I don't even know how else to describe it. So it's really hard to plan for and understand what your reimbursement is going to be. The last thing I will say is that our healthcare system is built on treating illness and not really focused on prevention. And I am hoping that as things change in healthcare, which I know for a short time may be for the worse, but that when we are really starting to think about how do we rebuild and rethink about healthcare, that we reimagine that prevention is actually something we want to invest in, because we know if we invest in kids now, if we invest in preventing asthma, preventing obesity, preventing mental illness and violence, that we can actually make a difference in the life trajectory of not only individual patients, but our entire community. So how do we look at things differently? So one is lack of access. Another kind of startling statistic is that the rate of ER visits is about 86% higher for families with low income. So how do we address that? Well, we answer the phone, number one. I always say that because it's, I think, a really key important part of healthcare. You actually talk to a person. In addition, we have a lot of same day visits. So if someone is sick, then they can come actually into the office that day to be seen, because we know if you have a sick child, you can't be seen in a week. You can't be seen in actually even 2 days. We will do telehealth visits. We also have expanded hours. So every Wednesday evening we're open, and then one Saturday a month. And then we also do a lot of prevention work in the community, partnering with other organizations to provide what I would call like preventative services. Our mental health care is a huge focus of in actually everything that we do. So we know that less than 15% of children with low income actually get the mental health services they need. At BCP, our mental health clinicians are totally integrated into our medical work. So when a patient comes in, we have 2 full-time licensed mental health clinicians. When a patient comes in and is having a therapy visit, I'm actually, as their pediatrician, participating in the therapy visit so that I'm titrating medications, I'm checking in on them, I'm seeing how school is going, and I'm making changes. Similarly, mental health clinicians will come into our visit. I actually saw a patient yesterday. She was very resistant, a teenager, and I was able to bring one of our mental health clinicians in. They had a conversation and they agreed to meet next week. We also have a consulting child and adolescent psychiatrist who now is coming into our office and seeing patients at least monthly in person on site, which is a new development, which has been amazing. And we also have a consulting child and adolescent psychologist who is supervising 2 externs and helping us PhD, when I say externs, they're PhD students who are going to be in our office just starting this month to help see patients, help us run groups, and help with that fully integrated care. As far as our care navigation and wellness services, we know that children are in need of many things, but I think strikingly is food at the moment. So 25% of households with children in Massachusetts are food insecure. That's 1 in 4. So at BCP, we have care navigators and family partners. We use that term interchangeably. We've now, I think family partner really talks more about how we do the work. So we're using that term, but they are on site. They are, again, coming into our appointments with us. Again, yesterday, I'm seeing a patient, a mom who's having difficulty making ends meet. One of our family partners was in the visit with me, hearing about how this work is being done. Hearing about what was happening with the mom so that the work can be done together. And so when that family partner leaves, we're going to then continue to do the work, continue to work with the family, find resources for them to really help. So additionally, we're able to not only do a lot of work on site, but then we have a lot of partners out in the world who are also doing incredible work, who we're connecting families with. In fact, the family I was seeing yesterday lives on Cape Cod, and we were connecting them to some services there. Additionally, at every visit, families are given food and hygiene products, clothing, diapers and wipes, feminine hygiene products, because we know that if you give people things when they come into the office, that's the time to make sure that that happens, as opposed to asking people to go to 5 different places to get 5 different things. Lastly, we really lean into the relationship between providers and patients. And we know that a 15-minute visit is not enough time to actually address people's needs or even really kind of get much done, frankly. And so I don't even believe in a 15-minute sick visit at our office. All visits are 30 to 60 minutes long, and may even be longer at times. And that way we are able to really kind of ask families how things are going, understand what's happening for them. In addition to many of the things that I've mentioned, we do have we have daily rounds. So every morning, actually, from 8:50 to 9, we actually round together as with all of the people I've mentioned. So the mental health team, the care navigation and wellness team, as well as all the medical providers, medical assistants, front desk, we're all talking about who's coming in that day and who wants to talk with who, so that we make sure that everyone is getting their needs met when they come in. We also offer flu and COVID vaccine for parents, which I think is really important because many parents prioritize their children's care, but not their own care. And so we want to make sure that at least vaccines are available. I have really talked about this. These are some of our the artwork you can see in the background, but how it's so important to lean into the relationship of medicine. I think it's something that's kind of been lost, and that we are kind of bringing back that idea of like the doctor who maybe brought their black bag around to everyone's homes. We're not actually going to people's homes, although we have, but actually bringing people into like what I would consider our home to provide the care. We've talked a lot about our mental health integration already. These are both of our mental health providers, really finding unique ways to connect with families, and make sure that kids feel really comfortable when they come in. And also one of the biggest things that we're doing is breaking down stigma so that people understand that their mental health and their physical health are completely related and that you're actually going to get it all done in one place with people who are connected. I think one thing that happens so often is that people end up getting their mental health care someone totally different than their physical health care, and it's really hard for those providers to connect. Again, I've talked a lot about our care navigation and wellness service. This is our closet that we have where families can actually shop at no cost for anything that they need, and we get many things donated through that. We are able to support families in really deep ways around housing. We're not just referring them to what I call screen and refer, giving them a piece of paper to go somewhere else. We're actually helping them with their applications. We're applying for RAFT with them. We're following up with them. We've gone, to housing court to support families, like whatever they need. We've also done a lot of work around utilities, as well as early child care, education. We work with an organization called Ed Navigator to support our families around education. We run some after-school programs ourselves and also connect families to other after-school programs. But we have one of our family partners is fully focused on wellness for families. And here are the wellness services. So we have a number of different after-school programs. I would say our most popular is our cooking class, where we send food to families ahead of time so that families have no barriers to participation, have a healthy meal that the kids then cook for the parents every week. And through that, kids are learning about fruits and vegetables. They're learning, they're engaged in cooking with their families, and they're actually so proud to serve their family a meal. We do that over Zoom so that families can participate, and then a number of patients are actually in the office cooking as well. We also have a number of other groups, like our Strong Mom, Healthy Baby group, which is for the first year of life. Families can get their well child care visits together through a curriculum where they meet every month together, the same cohort. So it's like a play group as well. And it has been so popular. We've done this a number of different cohorts that they ask for a toddler group. So we're excited to say that we are launching our toddler group next month. We also have 4 special events a year at times of high stress where we know families are really struggling to make ends meet, which is back to school time, Thanksgiving, the holidays, and then getting kids to go to summer camp. We do a number of different things to help families, but most importantly, we provide very high quality items. Like for instance, for our holiday shop, we take over an empty space. Families can like shop for presents that are then wrapped by volunteers so that they're able to give with dignity the presents that they wanted to give to their families. And then they also get a gingerbread house and stocking stuffers and pictures with Santa and food and produce and everything that they need to make their holiday celebration special. We also, as I mentioned, are in the community doing some preventative care with some of our partners, such as EBA, the base, and we're starting to talk to some other partners about expanding this care because it's really like a preventative medical and mental health curriculum where we have, kids from after school sports activities talking about goal setting and stress relief and I think these are the things that are going to really help build up our communities and make kids more resilient in the future. We've already talked about the quintuple aim, so I'm going to keep moving. But just to give you a quick snapshot of how we are really kind of um, making sure that we are looking at how are we doing against the quintuple aim. For instance, improving patient experience, 99% of our patients through an annual patient experience survey say that their provider listened to them and explained things clearly, which is something that only 77% of patients with low income in Boston typically report. Our no-show rate is about 10%, which compares to about 30% at many community health centers. And that's because we Uber people to appointments. We make appointments when we know people can make it. And then our cost of care is really quite low compared to just like one emergency room visit, for example. So it's about $2,600 per year for everything that I've described, whereas one ER visit can be close to like $2,000. And so if we're preventing one, we're really making a big difference. We've retained 100% of our medical staff and providers since opening, which is really something that I'm very proud of, especially given sort of the rapidly declining kind of healthcare staffing structure. And then equity. So we really believe that we're trying to break cycles of poverty, break cycles of racism that exist in the healthcare system. And we really offer all the services that I've mentioned to all of our patients in a way that really centers equity. We've done some things to work on systemic change in the interest of time, because I know I want to leave a couple. I know we're kind of at time. We are trying to change the healthcare system. We're not just doing this as one site. We are doing this to create a model that shows that change is possible and there's a better and different way to do things. And we've already expanded once within our own building. We've done an initial evaluation and we are thinking about sort of what's next and what's on the horizon for BCP. So it's an exciting time. As I mentioned, we're hitting our 5th anniversary and we're excited to see all that we will be able to do in the future.
Thanks so much, Robyn. This was amazing. Great slides, and congratulations on the anniversary and all the good work you're doing. It's
Thank you.
inspiring and it's resonating with a lot of folks here today. People have given you a lot of kudos in the chat, noting similarities between our sort of early childhood, early education and care sector.
Yeah.
I think in terms of integrating services, centering equity, um, and some of those themes. 100% staff retention rate for the win. And the 10%, what is it, 10%
No show.
cancellation
Great.
no-show rate compared to 30%, which is more average. Everybody who's tried to get an appointment knows that if you don't have an appointment, sometimes you can call and see if there are cancellations as it gets closer to the day of an appointment for wherever you're going for healthcare. I did have a question about advocacy. And
Yeah.
I saw you have some partners locally, but do you have any state advocacy partners?
Well, I mean, we are talking with Mass Health all the time
Yeah,
but not like one specific partner, but it is something that we're always looking to build our network around. So I would love to connect around that because I think, um, we're talking with our legislators as well, and Cindy Friedman, who's done a lot of work around primary care work. But just anything that we can do to get more sort of funding in, like, I think the early childhood space has done an incredible job. But more funding into this preventative work. So
great. And if anybody in the chat has ideas or here has ideas for Robin about that, please put it in the chat or we can connect you afterwards. I'll save the chat too and send you everyone's.
great. Thank you.
Just
Robin, one thing
go
we
ahead.
had good morning. We had Dr. Fowler on yesterday from
Yeah,
and
saw that.
yeah, what and so she gave us kind of an infectious disease update. What
Yeah.
have you seen from the families, like kind of about the current situation that we're living in? What kind of supports are they needing, or how are you handling kind of questions or fear?
Yeah, I mean, we're really leaning into this. We've been doing this since we were one of the only pediatric practices who actually had the COVID vaccine available for both patients and families and the community.
Hmm.
And so this is not new to us, this kind of vaccine work and vaccine hesitancy work. But so we're available for questions. We have the vaccine on site. We have adult COVID vaccines at our office. We don't have the child ones yet because there's still a lot of I don't know when they're going to be released, but as soon as they are, we will have them. We haven't had the opportunity to order them, but we yesterday got in our adult COVID vaccine, I think before CVS, so I'm kind of proud of that. Um,
Great.
so we'll continue to promote that and talk about the importance of it and dispel a lot of the myths and misinformation that is, of course, now becoming so much more prevalent and harder to understand, I think, for people, right? Because there's so much misinformation coming at people from different angles that's
Right.
challenging. So we're trying to be the voice of reason, and I think that's where like our trust and our ability, I've taken care of some of the patients that we have there for 20 years, two generations, like
Right.
they're like willing to engage in that conversation because of that.
And folks should know that Robin was on her way in and there was a huge traffic accident. So she is pulled off at a hotel to do the 9:30 call. So we completely appreciate that and don't want unnoticed.
Yeah, the Hilton DoubleTree was very nice. They gave me a room and everything. So anyhow.
And thanks to Titus for jumping in as I also was delayed getting to work. But thank you so much. Titus, I'll turn it over to you for goodbyes.
Sure. Thanks to everyone for joining this morning. We'll save the chat. I'll send it to Robin, and if you send us the slides, we can post them in our 9:30 call
Great.
Google Drive, and we'll put the recording on our YouTube channel. Tomorrow we have Danielle Ewan, I believe, with a federal policy update. So you won't want to miss that. And thanks again. Have a good morning, everybody.
Great. Thanks, everyone.